Good morning. My name is Tiana Brown, and welcome to the Early Childhood Briefing, the 2021 General Assembly Session and UVA Report webinar. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. All participants are placed on mute for quality assurance. You will have the opportunity to submit questions to today's presenters by typing your questions into the questions pane of the control panel. You may send questions at any time, and we will address them during the Q&A sessions throughout and at the end of today's presentation. I would now like to turn it over to BECF President Kathy Glazer.
Thank you, Tiana, and good morning, everyone. We're so glad to have some time with you to hear some really important information. We have some terrific speakers for you today, and appreciate you all taking time out of your morning to learn more. We're going to be hearing first from Senator Jennifer McClellan, an overview of a bill that she's patroning in process in the General Assembly right now. Then we'll hear from David Carey, who is the Chief of Staff to the First Lady of Virginia, and he'll be reviewing some of the administration's early childhood priorities. And then we'll hear from Dr. Daphne Basak with the University of Virginia, who will be sharing some information from a recent report and research that she has done that I know you'll all be interested in. First of all, though, I'm very pleased to welcome Senator McClellan and turn the floor to her. She is such a champion for early childhood education, and also has, really a careful understanding of what is needed for the childcare industry to be stabilized and ready to be able to continue to operate and serve children all over the Commonwealth. So, Senator McClellan, welcome.
Well, thank you for having me this morning. Thank you, Kathy. And I'm coming to you live from the Science Museum, which is why I have my mask on. And the bill I'm about to talk about just reported out of the Senate Education and Health Committee, was re-referred to the Finance Committee, so is making steady progress. And to tell you a bit about the bill, let me back up a little bit. I have seen firsthand, both as the child of educators, including an early childhood educator 50 years ago, the parent of two students now in elementary school, I've seen firsthand that early childhood education lays the foundation for our entire education system. And that was hit home to me when my son started kindergarten, and I asked his teacher, what's changed in the over 20 years you've been teaching? She said that kindergarten used to be where the soft skills were taught. Now it's all academic, and she can usually tell on day one which students had some form of formal early childhood education and which ones didn't. So it's not just theoretical, I see it every day. And I knew, like you, before the COVID pandemic, we already didn't have enough quality, affordable childcare to meet the demand, particularly for infant care. COVID has only made that worse. More than 30% of Virginia's childcare facilities have closed during COVID. Over 1,000 remain closed. And so what this bill does, Senate Bill 1316, is begins to stabilize the childcare and early childhood education industry in three main ways. First, we need to provide more flexibility for our providers to hire staff and to use substitutes. And we know a big barrier to that is the criminal background check process, where every time someone applies for a job, they have to get a new criminal background check, even if they've had one already in the past 5 years. And I've heard stories from people who were maybe applying for multiple jobs at one time. This is especially true for those, just entering the workforce. They have to get a background check for each application. You have graduate students who are in a program at a school, and to get a job as part of their education process, they have to get another background check. So this bill will create portable background checks that follow the employee, so that once you have had a background check within the 5 years, you don't have to get another one. Critically important to help address the workforce shortage. On the funding side, the bill will establish a 2-year pilot program where the state will contract with providers on some inputs for high quality, what it means to provide equitable compensation for employees, but most importantly, as part of this contract, federal subsidy dollars will be allocated based on enrollment, not attendance. Because we know no matter how many kids show up on a given day, you've got a plan, the provider has to plan for the number of kids enrolled. And those costs don't go away just because a kid does not show up on a particular day. We have definitely seen this happen with COVID. We're in a lot of places where the facility stayed open, kids stayed enrolled, but parents chose not to send their children. The provider had to be prepared for those kids to show up on any given day, and that's just killing a lot of our centers. So this will be a 2-year pilot program. They'll report back information to the General Assembly to see how it goes and how we can expand this statewide. And then finally, the bill creates a work group between the Department of Education and the School Readiness Committee to evaluate not only the pilot, but how we can make other changes to how we fund early childhood and childcare. Because we understand we've got to shift more to a model that is not market-based. Because if you're going to provide high quality, you need to pay the workforce like the professionals that they are. And the more you pay the workforce, the more expensive childcare and early childhood education will be under the current model. It's just not sustainable. And given that early childhood is, the education process begins at birth, the equity gap begins at birth, it is time that we start to view this early childhood education as part of the full continuum, and that most child care providers are not simply babysitters, that they are providing education even among our infants. And so I'm very excited about this bill and happy to take any questions about it before I've got to run back to committee.
Thank you, Senator McClellan. Let me see if we have any questions for you. I think you probably were so clear and your message so right on point that I don't see any questions about specifics of the bill. We are so grateful to you for carrying something so important. And I think, let me just see. We do have a question or two that's popped up.
Okay.
The new out-of-state background check requirements where the applicant has to have them before hire is not feasible, as some take 30 to 60 days. Can that be amended? And I think this is about, kind of the length of time that it takes to get that process in place.
I will, that process, that was not something that has come up as the bill has gone through committee. So I will definitely take a look at that. Thank you for flagging that.
Thank you. It looks like there's one other question similar to that. So it does seem like sort of the length of time for those background checks to go through. That's right. Okay. Yeah, I think you're good, Senator McClellan. Thank you so much. And good luck to you. And we will look forward to seeing you again soon.
All right. Thank you, everybody. Have a great day.
Appreciate you joining us today. Thank you so much. It is a busy day today, and our next speaker has just beamed in from a committee hearing, but we're really pleased to hear from David Carey, who is our next speaker, and his title is Assistant Secretary of Early Childhood Education, and he's also Chief of Staff to the First Lady of Virginia. And in all of his spare time, he's going to join us today to give some information about some of the bills and priorities for the administration in the current General Assembly session. David?
Great. Hello, everyone. Good morning, Kathy, and thank you for having us. Senator, if you're still there, thanks for joining, and thanks as always for being an advocate for children and families during session. So I will give everyone sort of just a brief update of what's going on in Richmond right now. Some of you I know are involved in the General Assembly every day. Some of you a little less than that, and some folks not at all, obviously. So I'll give a sort of a general overview here. We've got a few bills up. Obviously, the senator spoke to hers, 1316, so I don't need to review that. But we also have on the House side, Delegate McGuire has a bill, HB 2186, which covers the background check aspect of Senator McClellan's bill as well. So support for that moving through both chambers for making a change to the way we handle background checks here for folks. If you remember last year, we had obviously a pretty significant piece of legislation that a lot of you all here helped with, that VECF and others played a big role in, and that was the bill carried by Delegates Bulova and Tyler in the House and by Senator Howell in the Senate, which moved oversight for our early childhood education programs across the state over to the Department of Education. So that bill set a timeline for that to be completed by July 1st of this year, and despite the disruptions, to say the least, caused by the pandemic, the teams at DSS and Department of Education have worked through, figured out a way, and we're still on track to do that with no delay this year. Some pieces of that operation have moved over, like the Head Start Collaboration Office, for example, and then finally the large federal block grant will move at the end of June this year. So that's good progress. We also, in that bill, as a lot of folks know, we required that by 2023 all programs receiving public funds would have to participate in a quality rating and improvement system. So given the disruption of the pandemic, we had Delegate Bulova this year carry House Bill 2105 in the House, which is, I believe, should be on its third reading, meaning a final vote on the floor of the House of Delegates today, actually. And essentially what that does is it relieves a little pressure on our early childhood educators. It moves that requirement to 2024 so that it treats 2023 as a practice year for participating in that quality rating and improvement system. It also continues for those who are followed or attended or been a part of the school readiness committee. What it does is it extends that school readiness committee beyond this July, when it was currently set to expire. And it changes the focus a little bit of the School Readiness Committee. So for those who don't know, the School Readiness Committee was set up in 2016 by the General Assembly. And essentially what it is it's a group of folks, including the private sector, nonprofit stakeholders, including VECF, as well as members of the House, Senate, Governor's Office, and state agencies to work together, as well as institutes of higher education in the state to essentially work together to address issues affecting the early childhood system in Virginia. And so that Delegate Bulova's Bill 2105 also, like I said, extends that school readiness committee and changes the focus to look at essentially financing and affordability for Virginia families moving forward of our system. So obviously that's something Senator McClellan mentioned before, and fortunately something that the General Assembly is paying a lot more attention to now, is affordability for all families and access across the board for early childhood education. So that's Delegate Bulova's bill is at least one piece of legislation that the administration's most focused on, because it essentially is a follow-up or a technical cleanup bill to the large piece of legislation passed last year. Of course, we're also tracking Senator McClellan's bill, Delegate McGuire's, and then finally, as Kathy said, I was just in the House HWI committee, the Health, Welfare, and Institutions Committee in the House of Delegates, where Delegate, or rather Speaker Eileen Fillercorn has a bill, HB 2206 or 2206, and essentially what that bill does is expands eligibility for more families to our Child Care and Development Block Grant, or to our subsidy program that's currently run at DSS. So, you know, obviously currently we have a relatively low income threshold for families to receive subsidy. This bill moves that threshold up to 85% of the state median income, which is roughly a family of, and I don't want to get these numbers wrong right now, but roughly a family of 4 living in the most, one of the most, in Fairfax County, where state median income is pretty high, or local median income is high. That would be about a family of 4 currently qualifies at about $65,000, and now would about $88,000. That same family would be able to qualify for subsidy, to be able to use subsidy and with private providers. So it also expands the eligibility requirements a little bit, so that currently, as you know, families have to either be working or in school to qualify. Now we added as an eligibility requirement that you can be on searching for a job. Obviously, this is in response to a lot of families out of work and under increasing economic pressure during the pandemic. And so what would happen is this eligibility would be granted for 12 months to these families, and they would have until July 31st to apply for subsidy. The other important note is that this wouldn't be all families with children 12 and under. This would be targeted toward families who have at least one child age 0 to 5 in the household. So for example, if you had a 10-year-old child in your household and only that one child, you would not qualify. But if you had a 3-year-old in your household and another child that is 10 years old, they would both qualify together. So essentially, this is to target families who have children in that age range of 0 to 5, which we know is the most expensive and especially critical for school readiness right now. So that's essentially what that bill would do. There's a new substitute that's been uploaded. So for folks who know how to use can Google the Virginia's Legislative Information System, or LIS, you can find HB 2206 on there, and that will show you some of the new substitutes that were literally just adopted minutes ago and passed on to the floor by a vote of 21 to 0. So I think overall what that shows you, and that's not, you know, multiple bills, including Delegate Bulovas, have passed unanimously out of committees, and I think that shows, thanks to the work of everyone on this call, VECF and other partners here, the General Assembly is understanding the importance of this now. Like you heard Senator McClellan say, there's really no doubt from Republicans or Democrats that this is important. I think as a group, what we have to advocate for now is investing the money it takes to really grow these programs. So like I said, all of these bills, no one's questioning them. There's no partisan sort of divide on this, but the budget is where the next is really the next hurdle for us, or the next challenge is working with the General Assembly to move early childhood education up a little bit higher. And so that's where I'll talk about what the governor's done in his budget for this year, and a little bit about what we can do, you know, moving forward. And so in the chat, you'll see there is a link where you can click to see the document I'm going through right now. But essentially what this is a handout that looks like this. If you haven't already received it, on the front page, it starts with a little bit of the information that we've been able to gather from Department of Ed in recent weeks. I think we all know on this call that COVID has had a negative impact on our youngest learners, but I think we've now been able to quantify that, and it's especially concerning. I think we've seen on our PALS assessment a drop in literacy skills among our kindergartners this school year that is 5 times greater than any drop we've seen since we started measuring this data in 1997, which is that really drives home the point that this is affecting our youngest learners, and there is unfortunately a higher impact among our Black, Hispanic, economically disadvantaged students and students who are English learners. So I think now more than ever, these extra investments and using federal funds strategically to help these children in these first years are critical. And I think that the General Assembly is understanding that more than they ever have before, which is good. But that means that there is certainly work to do right now. Not to mention the social emotional well-being of these students. Kindergarten teachers are reporting concerns about social emotional well-being at higher levels right now, as I'm sure you could expect, than they have in previous years. So on the second page of that document, we ran through at least what is in the governor's current budget to address some of these concerns. So at the top there is a section called Equity and Access, and you'll see that what he's done is what we call fully restored the teacher recognition grant for next fiscal year, which is $5 million. And this teacher recognition grant is essentially, for some folks here may be familiar with this, for teachers who are in centers or family day homes that are participating in the preschool development grant. These funds would provide $1,500 grants to each teacher participating. Approximately 3,000 teachers would be able to benefit from this $5 million. The reason we say fully restored is that all of these items, or most of these items, were passed by the General Assembly last March. And if you all remember, we passed a budget that invested over $85 million over these 2 years in new funds to early childhood education. And literally days after that budget passed, our first cases started to rise in Virginia. The governor obviously had to start moving toward our first stay-at-home order. And as a result, in order to, because of the economic downturn caused by that pause, we essentially froze or unallotted all new spending. And so the General Assembly, in a special session last summer, restored a good piece of this, about $40 million of this funding, and the governor is restoring an additional $16 million of that funding in these items here. So what you see on this sheet looks like a small number on the state scale. That's because these numbers are not the full investment that the General Assembly has made in these items. This is simply the additional funds that the governor is adding in state general funds this session to these initiatives. So basically what this means is that if the governor's budget passes as it's written here, which we've highlighted here, it would essentially get us back to exactly where we wanted to be in fiscal year 22, which is next year, after basically pre-COVID. So we're returning to these pre-COVID new spending levels with this budget. So you'll see that the next item there is $444,000 to fully restore our pilot for at-risk 3-year-olds. So as you know, another thing that we did in the budget and legislation last session was allowed for on a small scale, on a pilot basis, for 3-year-olds to be in our mixed delivery and VPI classrooms across the state. And obviously a lot of localities embraced that pretty enthusiastically and used all of their slots and requested more, which was fantastic. And so we're increasing that again for the next fiscal year. And the hope is that our members of the General Assembly can see the results of having 2 years of quality early childhood education for these children, and that they will continue to fund this even further. The other two items here, $300,000 to eliminate wait lists and $642,000 for ratios and class sizes. By increasing our ratios in our state pre-K classrooms by just 1, we can essentially create about 2,000 additional slots for children who need it most in Virginia. And so these are additional funds to cut down on wait lists and to essentially have our state pre-K ratios match Head Start ratios right now nationwide. Down in quality and sustainability, finally, you'll see that $9.7 million to fully restore the increase to per pupil amount for VPI. So that increases the per pupil amount by 10% that we're paying for each child. Finally, we have 2 new items on there. So this is a $300,000 expansion of the Virginia Kindergarten Readiness Program. So that is essentially expanding to all public pre-K kindergarten classrooms, and so all public pre-K and kindergarten classrooms in this coming school year. And obviously, as we've seen on that that data on the first page there is already showing us pretty concerning results for our children during the pandemic. This will give us even more data about exactly who is falling behind and how we can help them as they move through elementary school. And the second new item of funding right here is to create a deputy superintendent for early childhood education at the Department of Education. So a lot of you here might know Jenna Conway, obviously, who the governor hired and recruited in 2018 to join us in a position we called Chief School Readiness Officer, which is the first time we've had that position in Virginia. This was a position meant to bring together folks from Department of Social Services, Department of Ed, and elsewhere to sort of create one unified plan for early childhood education here. And the way that works is because that position is appointed by the governor. When Governor Northam leaves office about almost exactly a year from now in January 2022, that position and everyone, including mine in the governor's office, is terminated, and the next governor decides to reappoint some people, bring in some new people, change positions. Every administration has different priorities, and so what this would do is create a position that does the same thing, essentially, that oversees all of our early childhood care and education programs that happen outside of the household. But rather than being subject to every governor's appointment, this would be what we call a permanent or classified state employee position. So this would be as sort of permanent and long-term as you can get. It would be meaning that a senior person at Department of Ed would be overseeing all of this work going forward, which we think is really important to sort of sustaining what we've done and growing this program for years to come. So we're excited about that. And finally, the final piece here is just flexibility language, we call it. So this is language in the budget that allows us to respond better at a local level to needs of children. So this means that the first one is maximizing the local use of VPI. That means that if a locality receives, for example, a certain amount of money for addressing wait lists or for addressing class sizes, but they've covered all of those expenses and they still have extra money that school year, but let's say they have maybe a wait list of 3-year-olds trying to get in. They can shift that money away from their what was originally allotted for ratios and use those funds to bring those 3-year-olds into classrooms. So previously, and we've been working to increase this, but there were pretty rigid rules around how this money could be used. So if a school division got too much money for one aspect, not enough for another, that there was nothing really that they could do about it until a future budget year. So what this does is just gives folks at the local level more ability to use these funds in whatever way works best for their locality and for their youngest learners. And then finally, this establishing special education inclusion targets for VPI classrooms is encouraging essentially our school divisions and our classrooms to blend and make more inclusive classrooms rather than separating our students with special needs. So that is a fairly technical run through of a lot of information. Like I said, the link is there, which can be clicked on, and obviously our team is happy to answer any questions you all may have about that. I think also obviously vaccines are on folks' minds, and I know not everyone can log in to see the governor's press conferences at 2 o'clock, which are weekly or semi-weekly. Yesterday, obviously, he had a press conference and expressed that he understands the frustration of folks who either don't know where they need to go to get shots, who have seen neighbors, friends, family, other folks get shots while they remain unaware of how to get them. I think he acknowledged that and ran through some of the things the state is doing to address that. I think for one, it's worth taking a step back and realizing that this vaccine was not available until about halfway through last month. And in that time, for perspective, we announced that we wanted to vaccinate 500,000 people in the first month. And now a month later, 520,000 people, primarily in those long-term care facilities, healthcare workers, and some others have been vaccinated. So that 520,000 shots is actually greater than the number of people who have contracted COVID or tested positive for COVID over the entire first year of the pandemic, to just show you some of the scale. But obviously, we have many more millions of people in Virginia, and there's a lot more work to do. So private providers like CVS and others have come on board to help us get through some of these most important groups, including our early childhood education workforce, which is as you all know, in Group 1B, which as of, I believe, today or yesterday, all localities in Virginia have just moved on to 1B. But of course, there are a lot more folks to reach there. I think the other piece that gives us some hope is at the federal level. As you all saw, the end of the previous president's administration, we had at the federal level guidance sent down telling all of us to get all of remaining shots out as quickly as possible, and that more were coming from the federal government. Obviously, 1 or 2 days later, we learned that was not true, and in fact, there weren't more doses coming. So there was an expansion of eligibility, folks ready to get vaccinated, and then word came down that actually we don't have enough shots. And I think that type of frustration at the federal and down to the state level is felt by everyone, and I feel it myself, so I understand. But I think there's reason for hope. The governor's been in touch with the White House and folks at the federal level, and I think from the vaccine manufacturers who now have a better grasp of how to rapidly get these out, to an administration that's at the federal level that's creating a plan for the first time to get this out. I think there's a lot of hope. You may have seen President Biden's plans for the number of vaccines he plans to get out in the next coming weeks and months, and the goal of vaccinating everyone who wants a shot by the end of this summer, which is great. But obviously, we know folks who are dealing with and working with and caring for children throughout the entire pandemic need shots yesterday, and so we're working hard to get that done. And as the governor also said, you all soon will see from your local health districts a program laid out basically online and by phone, where you can directly register for shots. So for folks who are directors of centers, we're encouraging them to reach out to their local health departments to get more information about how you can vaccinate your employees and when. And some guidance will shortly be coming from the state level specifically for child care and for early education settings in the coming days here. So that's a little bit about vaccines. And I think the last thing I'll say is before we go is that just reiterate that the work all of you have done from engaging with families and children to what you've done coming to Capitol Square when we were able to do that in person in previous years, from calling and writing your legislators, from participating in listening sessions we've had. Fantastic progress has been made, and I think the greatest progress is in the hearts and minds of legislators here. We elected a new leaders in the General Assembly in the past couple of years, and even the folks who have been there a long time. I think I've seen just in the past year, 6 months, a pretty remarkable turnaround in the attitude towards the importance of early childhood education. But we're far from over. It's still for many families unaffordable to access quality care and education, and I think each of you having conversations with your local delegate, with your senator, with your school boards, with your superintendents is going to be extremely important, because there's, as you all know, from the local to the state level, there's a lot of people involved in the process of increasing access, whether that's in a private provider or in a school. There's in family day homes and across all settings, we've been working at the state level to try to increase access, but it's not going to happen overnight. It's going to take everyone here continuing to engage with their legislators, leaders at the local and state level. So essentially, thank you and keep it up, because we need all the help we can get to move this issue forward. And thank you all for being here today.
Thank you so much, David. Do you mind taking just a few questions?
Sure.
Thank you. I appreciate that. And we also, I think Jenna's going to hop on a little bit later after the Board of Education meeting. And so, some of these questions we may want to, let her go into more detail. But some of our folks, there are a couple of questions. One is, a number of questions around getting the vaccinations and, how to best do that. You want to share a little bit about this new tool that has just been announced? I don't think it's ready yet, but we'll be rolling out soon.
Yes, and essentially a couple of things are coming on. One of those two is they're making improvements to our vaccine summary dashboard. And so in other words, what that means is increasing the amount of information you can see when you go online, and in terms of transparency and seeing daily what type of progress the state is making. You know, earlier in the pandemic, we were able to, for example, get the Department of Health to include on their dashboard a list of outbreak data for childcare facilities, essentially, is the way what they called it on there and how they broke that out. We'd like to be able to do that for vaccines as well, where you can see exactly how many of your peers and colleagues across the state have been vaccinated, and it provides a little bit of transparency and a little bit extra sort of public pressure to keep that process going. And then the other piece is like we said, there will be online tools at the local level, but created at the, let me back up. So the state essentially has been in the process of for months now of creating a better unified online system for not just to get information about whether you're eligible or to answer questions, which you currently have, but to connect you directly with a time and a place for you to get a shot. So if folks remember, originally the plan was to expand eligibility in February. So the timeline the state was on was to create an online system that made this easier for you to get directly connected to a shot by February. Obviously, when the federal government earlier, I believe this month, made a somewhat surprise announcement to expand eligibility to more folks, demand increased rapidly, and the online systems at the state level were not ready yet to handle that. So essentially what that means is soon you'll be able to get directly connected to a shot. But for folks who want information now, of course, there's the state VDH website, local websites, but there's also a centralized phone number. And we can, I'm not sure if I have the ability to type to everyone in the chat, but the phone number is 877-ASK-VDH3. And if that comes out to the digits are 877-275-8343. And if that's if we're not able to get that in the chat, I'm sure we can email that to you elsewhere. But calling either the state line or your local department is the best way to figure out where you are and what you can get done today.
Terrific. David, thank you. We'll make sure that information gets in the chat. Couple more questions, and then we're going to let you get back to your day job. We really appreciate your being here and all of your efforts, David, with the legislation, with the improvements made, and with the issues around vaccination. Just really appreciate your time and leadership there. Several folks have asked questions about increasing subsidy rates, and wondering too whether with the minimum wage rolling out, whether there's been consideration of subsidy reimbursement kind of accounting for those additional costs.
That is a good question, and when it comes to the subsidy rate and those federal funds, if we I would, rather than giving an incorrect answer, I would wait for when either Jenna hops on, or if we have anyone with us from DSS right now, would be the best ones to answer that. But that is definitely a consideration. I've made a note of that too, to make sure we get an answer on that.
Sure. Thank you, David. And then just one last question. Just really appreciate hearing about the efforts to restore some of the funding and get back to kind of the pre-COVID new spending that was proposed. Based on COVID, of course, now the gaps and the needs are even greater than they were before. Is there some way, or how is the administration thinking about being able to target the new investments to those who've been most negatively impacted by the pandemic?
That's a good question, and I think there is certainly a need, and like we've talked about before, I think to have a bit of a more robust and targeted communication strategy, I think, for reaching those folks. We've seen participation in our federal subsidy program reach an all-time low recently, throughout the pandemic. And I think a lot of that too is I think fears from families. I think some of it might be potentially misunderstanding about who's eligible for subsidy. I think one of the things that the speaker's bill, HB 2206, does, like we said, was adds that ability for folks to use simply job search as a criteria for being eligible for subsidy. So if you don't have a job currently, if you lost your job because of the pandemic, if you're not currently in school, if that bill passes as it is written, that would be helpful, I believe. But I think a lot of it comes down to communication for folks. I think, and when it comes to making care eligible for the families who've been hurt the most, I think we also, as you know, and one thing I didn't mention was the federal funding that we've used, federal emergency funds that we've been using for providers, the CARES grant program that so far 3 waves have gone out starting last April. And I think in general, keeping more centers open, and especially keeping open our providers who provide, who take subsidy dollars is really key to making sure. I mean, and that's something that all of us here, and I think even the Speaker of the House recognizes, is that we can't do anything that jeopardizes the money that we've been using to provide those direct cash grants to providers. Because I think if the last thing we want is to move backwards in terms of number of centers open. Obviously, we still have about 900 closed, unfortunately, during the pandemic, but at the beginning, we were looking at about 40% of centers or more had closed, and we're up to the point where now 85% of folks are open, which is great progress. But we've got to, I think, be sure that we're continuing to get those CARES grant subsidies to providers, because the last thing we need is for them to close, and a family who needs it, whose children have been affected by this setback, don't have a place to go. So that as well is something that we're pretty focused on.
Thank you, David. Really appreciate it. And I'm sure you know we have an eager audience to be helpful. So we'll just make sure and stay in touch with folks. And if you can let us know along the way, if you need, some support or some voices raising, their, the need and the priority for some of these bills and budget changes, you know where to come. So thank you for that, Dave, and really appreciate your time today. Folks are really appreciative of the presentation.
Awesome. Thank you, Kathy, and thank you all.
All right, take care.
Bye.
Next, we'll move on to our next presenter, who is Dr. Daphna Basak, who is Associate Professor of Education and Public Policy at the University of Virginia. And Daphna is going to be bringing some insights from some of the research that she has been doing as part of the federal PDG grant. And Daphna, we're really pleased to have you present your findings today. These are really important insights, and I know our audience will be really eager to hear all about it. So we'll turn it to you.
Great, thank you so much, Kathy. It is great to have an opportunity to share with all of you about our findings from the studies. We can move to the next slide. The report that I'm going to talk to you about mostly today is about Virginia's Family Day homes into home-based settings and tracking what has happened to the providers working in those homes over COVID. So sort of looking at changes to their well-being and their operations before and after COVID. Next slide. But before I sort of dive into that report, I wanted to give you a little bit of context for the work we have been doing at UVA. So our team at UVA studies early childhood education policy with a real focus on the early educators. And so we have been partnering with Jenna at the Virginia Department of Education and the Virginia Early Childhood Foundation on a set of projects where the general idea is that if we are thinking about how to improve access to really high quality opportunities for all of Virginia's children, the focus has to be on improving the supports we offer to early educators, and that came up in both of the presentations before me around the idea that if we really want a high quality program, we have to think about all the teachers, educators working with children, not only in our schools, but in our childcare centers, in our Head Starts, in our family childcare homes. So when we set out to work together in 2019, pre-COVID, kind of everything that has changed for us since COVID began, our goal was really to learn more about Virginia's early educators, the experiences that they're having, and try out new strategies to support them and to look at the link between supporting early educators, improving quality, and ensuring that young children have great experiences across the state. So that was our goal, and then COVID sort of hit, and as all of you know, had a profound impact on all of early education, but particularly childcare centers and family childcare homes. And so kind of an additional goal has been, how do we understand those experiences on the ground and best target support? So some of you were asking, how do we find out who's struggling the most and who needs the most? And a part of our research has been around trying to figure that out to help the state target resources as effectively as possible. Slide. So I'm going to do sort of two things with today's presentations. The first is I wanted to give you an overview of some of the biggest findings we've had so far from our collaboration working with VDOE and VECF on early childhood issues. So basically 3 kind of big findings from that. And then after that, I will share findings from this new report, which is focused on family childcare homes, which has been a sector that has been particularly hit by COVID and also has played a really central role as far as being open and available during the past few months. So with that, I'll start with our sort of 3 key findings to date. Next slide, or 2. All right, so here is the first one. We have been tracking both before and after COVID how early educators are doing as far as their financial security, their well-being, how things are going for them. And one of the big things that have come out of that is just really concrete evidence about the financial insecurity that early educators are facing and how divergent those experiences are across the sectors that provide early childhood opportunities right now. And so in particular, this first report that we put out was comparing the experiences of teachers working in childcare centers to those working in the public schools, and highlighting just how different their experiences are as far as their financial well-being. So when we look at childcare teachers, we see that 40% of them, 2 in 5, live in households where their overall household income is under $25,000 a year. So very low levels of household income. Same percentage, about 40%, reported that they struggled to access food, meaning they were running out of money at home before they could get more, and therefore could not buy enough food for themselves or for their children. Over a third, and I should have said that this information is coming from a large survey we did of about 2,000 early educators around Virginia. And so a large sample with very high response rates. So really captured the experience as well. And in that survey, about a third of teachers said they could not afford to pay for their medical needs. Half said they did not receive health care benefits from their employers. So these are really very tough conditions, completely at odds with what we saw reported from pre-K teachers working in the public schools, who are way less likely to report struggling financially, and that is, on teacher salaries, which are not extremely high salaries either. So just highlighting a very large divide across sectors. And there are kind of 2 main takeaways we found from this work. The first is that although these conditions looked really quite stark when we surveyed teachers in May of 2020 when COVID hit, they were not caused by COVID. They also looked quite similar in May of 2019, a year earlier. They're capturing kind of long-standing financial challenges in how early educators are supported. So our finding from that really emphasized that when we think about COVID relief, there are a whole bunch of kind of new challenges related to COVID, but also some pronounced challenges that have long been there that need to be addressed, and those can't be sort of taken separately. We can't sort of just address the COVID challenges without addressing the kind of high levels of poverty of teachers. And the other point I wanted to make was that we know from quite a bit of research that these conditions for teachers, when you have teachers who are themselves struggling with poverty, lack of access to medical care, lack of access to food, that of course is going to have tremendous impacts for young children in a number of ways. One, just the quality of interactions, the quality of teaching, the quality of care that children can receive when their teachers themselves are extremely stressed, hungry, struggling, is much, much lower, and we know that has negative impacts for children. We also know that when teachers are experiencing these kinds of stressors, they are very likely to leave their sites. There's a lot of instability. Young children, more than children even in elementary school, really thrive on consistent relationships with educators. So the high level of turnover that they're experiencing is a really huge problem. And for the state, who's investing a lot in professional development and in supporting teachers, when you imagine so many teachers struggling so much, leaving their sites very quickly due to turnover, those efforts to improve quality are really suffering. So these results kind of emphasized for us the need to kind of stabilize and get resources to early educators to address some of these issues, hopefully improve stability, and in turn provide higher quality experiences for kids. So that's kind of our first one. The next slide. This one here is highlighting that while these financial conditions were difficult to begin with, COVID has created, as you all know, a set of very challenging conditions for early educators. And again, the way this played out was extremely different across sectors. I'll spend most of the presentation talking about home-based care providers, but here in this figure, I'm just comparing the experiences of childcare teachers working in centers compared to pre-K teachers working in schools. And you can see that there were vast differences in the impact of COVID for these two workforces. The kind of greenish looking bars are showing what happened to childcare teachers as far as employment drops. And you can see that over a third of childcare teachers, when COVID hit, this is from May of 2020, reported that they were no longer employed or were employed but no longer working. And similarly, almost 40% of childcare teachers said that their earnings decreased. And when we looked at that compared to pre-K teachers, things really went very differently for pre-K teachers. Schools immediately just went to remote instruction, and very few teachers' jobs were impacted as far as their salaries or their employment changing as far as accessing pay. So really highlighted the need to focus in a very targeted way on those sectors that have both sort of stayed open to serve families during the pandemic and the financial hits that those sectors are experiencing. And then finally, in the next slide, the last kind of key finding I wanted to emphasize was around the importance of financial supports for early educators. This is something that David touched on in his last presentation, but something we did even before COVID hit in partnership with VDOE and VECF is look at whether we could get financial supports to teachers, acknowledging kind of the very high levels of poverty and financial stress, the very high levels of teacher turnover in early education. We thought perhaps as part of the quality improvement effort, additional resources targeted directly to teachers could make a difference. And so early educators in the PDG communities were eligible to receive up to $1,500 if they continued working at their site over an 8-month period. And again, $1,500 was fairly significant for childcare educators. As you recall, I said 40% of those teachers have household incomes that are under $25,000. So it was a meaningful amount of money linked only to the idea of staying at your site and with no restrictions on how the money is used. It was money for them to spend on whatever was needed. And in one Virginia community, we were able to look at the impact of these funds on a variety of outcomes. We're still digging into the data, but one of the big ones we looked at is, does offering these resources actually lead to increases in stability? Because that's really one of the main things we're trying to improve, allow teachers to stay at their sites and improve stability for kids. And so I wanted to show you what happened with those funds. And what we found was that in the sites in Virginia where we were not able to offer the recognition program dollars, so we were not able to offer teachers $1,500, fully 30% of childcare teachers left their site over an 8-month period, meaning when we started the program, they were there. 8 months later, they were no longer working. Those are incredibly, incredibly high turnover rates, and they're not even capturing 1 year, they are capturing 8 months. So compared to K-12, when we see kind of single-digit turnover over the summer, these are really, really striking with very negative implications for the kids in those care. And then what we saw, which was extremely exciting to us, was that in those programs where we offered the recognition program, the likelihood teachers left was cut in half. So meaning rather than 30% of the teachers leaving, when teachers were offered this $1,500 recognition program, only 15% of the teachers were gone 8 months later. So that really highlighted for us the importance of financial supports as a strategy for improving teacher well-being, reducing turnover, and hopefully increasing learning and high quality experiences for young children. And we were very excited that that is something that the state is investing in further. So with that, those were the 3 kind of key findings to date. And then today, what I wanted to do with the rest of my time is share with you some findings specific to the family child care home providers. So next slide. One more. All right, so as many of you know, family child care homes in Virginia are home-based child care providers. The majority of them, really nearly all of them, are women, and the majority of them are women of color, and they play a huge role in our kind of early care and education system, especially for the youngest children, 0 to 3. Parents, even before the pandemic, often gravitated towards these home-based settings for more intimate, home-like settings, more flexible hours to support their work hours, a consistency of caregivers, and smaller group sizes. So even pre-COVID, these programs played a huge role in providing care, again, mostly for infants and toddlers, but some older children as well, and aftercare for school-aged kids. Next slide. But what we were really noticing is what an outsized role family day homes have played during the pandemic. And so what I'm showing you here is just the percentage of programs that were open in March of 2020, right when COVID began, and then just last month in December. And what you can see, those blue bars are showing you family child care homes, and you can see that they've just consistently throughout the pandemic, largely the vast majority have stayed open. So 80% were open when COVID hit, and we have been inching up to 90%. Whereas for months at the beginning of the pandemic, we had huge issues with closures for childcare centers. So in March, only 40% were open, and we are working our way up. 60% was in December, and I think we are exceeding 80%. So the childcare sites are reopening and moving through it. But during the pandemic, in the early months, family child care homes were really critical in serving the needs, especially of emergency workers, and providing them care. Next slide. So we wanted to better understand how the pandemic impacted those providers. And fortunately, we had done a survey of all the home-based teachers in May of 2019 as part of the preschool development grant project that we were doing. And so we went out in the field and collected data again in May of 2020. And it's a relatively small sample, but with a lot of interesting insights. So we are going going to show you today findings from 74 teachers who were there in both time points. So they were in a family child care home in May of 2019, and we were able to survey them again in May of 2020, either because they were still open and serving kids or because they had shut down due to COVID, but were still able to answer the survey and tell us how that went. And we tried to capture what changed for them and how they were experiencing dealing with the pandemic. All right, next slide. The first thing I want to show you is who these women are, and I say women, it was 100% women in our sample, about 50 years old on average. I wanted to sort of make sure to emphasize the racial composition of this workforce. You can see it is primarily women of color, so 70% of the early educators in our sample were Hispanic, Black, Asian, or other races. So primarily women of color, and that's, I think, important to keep in mind as we think about how they took on enormous risks and challenges over the period that we're studying here. Half of the teachers had no college education, so a high school degree or less. And as I mentioned, a very kind of low income sample with 51% of the sample being people with family incomes under $45,000 a year. Okay, so we'll keep that in mind as we look at the rest of the patterns. Next slide. All right, so as far as what happened to our sample of home-based providers in the PDG, nearly all of them, 86% of them, remained opened throughout the period that we looked at. So at least as of May, were open, and that looks really similar to the rest of the state, where, like I said, most family child care home providers remained open. But the vast majority of them, 77%, reported they were dealing with decreased enrollment, and 70% reported there were drops in their weekly earnings. So just to share one quote, a teacher wrote, "All of my clients are working from home. I went from a $900 a week income to zero. This has been a very difficult time in my career as an early educator." Next slide. As far as the challenges they were experiencing, 2/3 reported that it was now more difficult for them to stay open and cover their costs. And part of that was because of what we just noted, the drops of enrollment, but that was only one factor in the challenges. Next slide. I wanted to highlight a few things. So drops in enrollment for sure made a difference. They also had families that were still enrolled and still coming, but reported that those families were no longer able to pay as much as they were before because of their own financial challenges related to COVID. So many of the teachers reported accepting lower pay to do the same work in order to serve those families. Teachers reported challenges accessing and paying for needed supplies. So here I noted that on average, teachers reported paying about $347 extra on cleaning products and materials as of May. They also reported spending a lot of time on that and just struggling to find the materials they needed to keep their homes safe. And then the fourth kind of challenge that came up in a lot of the surveys from the teachers is that they were having struggles with staffing. So they either had staff that worked for them before have to resign, or they could no longer afford to pay for them. And for those who kept their employees on, they were reducing their hours. And so kind of a wide set of challenges making it difficult to remain open. Next slide. As far as what that ended up meaning for their lives, there was incredibly high levels of kind of financial stress reported by the teachers. So I'm not sure if the type here is a little bit hard to read, so let me sort of go through what the figure is showing you. That top bar is saying, I was worried about running out of money, and you could see that most of our teachers, 60% of teachers, reported concerns about running out of money and not being able to afford what they need. I had to make purchases on credit cards. I couldn't sleep well due to concerns about money. And arguments about money became frequent in our home. Many of my bills are past due. And so teachers are reporting incredibly stressful conditions, and taken together across these 5 items, 73% of teachers reported at least one of these financial stressors. Next slide. Just to sort of bring their voices into it, one wrote, "My enrollment has decreased because I had a lot of teachers' children. They are now at home and not paying since school closed and other businesses shut down. I'm having to use a credit card to pay for things because my income has decreased drastically. I don't know how long I can sustain doing this." Next slide. Here we compared rates of food insecurity from our first survey, which happened in May 2019, to May 2020, a few months after COVID hit. And so these are items that are asking teachers about their access to food. Those first set of bars say, I was worried that the food would run out in my house before I had money to buy more. And those lighter yellowish bars are showing that even before COVID hit, a quarter of family childcare homes in our Virginia sample were reporting those kinds of concerns, like being worried that you couldn't afford to buy food for your family. But you can see that the darker orange bar, which is from the second period, highlights a big increase in the percentage of teachers, up to around 40% of teachers highlighting that they are struggling to access food during the pandemic. You can see across all the measures we looked at, they kind of increased between 2019 and moving to May 2020. Next slide. And not surprisingly, with sort of everything I've highlighted, teachers reported very high levels of stress, and we also collected data about their kind of depressive symptoms. And over the kind of year that we compared these same group of teachers, so from May 2019 to May 2020, we saw almost doubling in the likelihood that family child care home providers reported clinically relevant levels of depression, from 7% of them to 13% of them reporting those depression symptoms, and had a lot of teachers write in things like this one: "My family struggles to get by each day and every week." So really just struggling to get through it. I think next slide is just another of these quotes. "It is very stressful to really not have a choice to be open because this is how I make an income. It's stressful to keep everything sanitized and disinfected so my husband and I won't get sick. He is close to 62 and I'm in fear he'll get sick because I've stayed open. I'm tired of this battle." Next slide. All right, despite these really profound challenges, when we asked teachers how they were feeling about their work, the work that they do with their children, the interactions they have with families, how they felt about their jobs overall, we did see that teachers felt and wrote in lots of their comments that they were extremely committed to the work. They realized it was important. They felt it was critical, especially during the pandemic, to stay open for their families and to support families that needed them. So very high rates of overall teachers agreeing that they were satisfied with the work they're doing. But as you can see, when we ask them about how things are going with their pay or with their benefits, those percentages really drop substantially. Of the teachers in our sample, 15% of them were relying on public assistance, and 1/3 had no healthcare benefits at all. And that seemed striking in general, and particularly striking during the pandemic, when we're thinking about those teachers who did not move to remote instruction, did not move to virtual, were serving kids every day, sometimes of emergency workers, themselves both feeling like they could not afford medical care and having no access to healthcare themselves. Next slide. So as far as key takeaways, I think both from this new report about the family child care workers and more broadly, I think we have been documenting that early educators, many of whom are women of color, are experiencing very high levels of financial hardship and stress. And I think it's really, really important to keep saying that that is getting exacerbated by COVID, but also was very much the case before COVID. And the solutions to these problems are not about kind of one-time fixes of what COVID created, though those are necessary, but around the rethinking how we think about funding and supporting early educators more broadly. As we know that these conditions and the experiences of early educators are not only extremely troubling for them, they have very strong impact on children and families that are being served, and thinking about creating high quality early childhood opportunities without fully addressing the needs of the early educators is just not something that sort of is internally consistent. And so I will wrap up there and would be happy to answer any questions anyone may have. Thank you.
Thank you, Daphne. Such important information. We do have a few comments and questions that I'd love to give you an opportunity to address, if you would. I think this is a comment that is, really resonates, because I know, Daphne, you're not just a scientist. You really, feel, all these data that you're collecting. And one of our participants says, great information. It's disheartening to see these numbers, that we're thankful that there's our data to support the struggles our essential teachers face. Just wonder if you, could speak to that. And, also, I think just our webinar today and sort of the series of speakers speaks to this cycle and sort of a process of the importance of gathering this data to be able to make compelling arguments, so that when we seek additional funding or changes in policy in the General Assembly session, that can be really informed by these data that are really disturbing, but super important to bring across. Just want to give you an opportunity to comment on that.
Yeah, I super agree. I mean, so I've been doing work on early childhood and early childhood policy for a long time. And I think that for people who do the work, a lot of the things that I shared today or am documenting seems like we've known that for a long time. But I think that getting these kind of large data sets and being able to put exact numbers on it, and also get the voices and the actual responses of the educators out there, captures just how serious these issues are in a way that I think is very concrete. And I do think that the pandemic has really increased families and businesses and policymakers' awareness of just how critical the entire early childhood landscape is, and sort of thinking about what childcare and family childcare homes need is going to be completely essential as we sort of move forward. So I think it's an opportunity, and I'm hopeful that getting this data in front of the right people, like on this call and through this partnership, is important for pushing that forward. And I especially some of the work we have been doing around in trying the teacher recognition program, testing its impact and seeing that it does work and works well, I'm hoping is going to be really compelling. And we've already sort of seen that information being used to get additional resources for early educators. So the hope is that by documenting and evaluating and doing this research, we can sort of help change the conversation.
Thank you. And also, I think there's, curiosity about how, I'm just thinking about the teacher recognition program, and, if you could share a little bit more of your, about the findings in terms of the ability to, better retain teachers in private settings, and why is that so important, and sort of what's the why behind that?
Yeah, that's a great question. I mean, so I think that the motivation for us starting to do that work is the idea that we know that teacher turnover is extremely high, particularly in childcare settings. So we don't see K-12 educators and we don't see pre-K educators leaving their sites mid-year, and especially for young children who really need the kind of consistent connections with caregivers. When teachers leave at high rates, that instability, what it causes for children, their development, for families who are relying on those programs, is really significant. And so when we were thinking about how do we kind of work to improve quality care in Virginia, a big piece of that is, like, first we need to think about how to support early educators and get them to stay. In some of the work we just did with our other partners in Louisiana, the rates of turnover over a school year in childcare were upwards of 50%. So half the teachers we see there in the fall are not there the following fall. And when instability is that profound, we can't really be talking about high quality early childhood education. So the recognition program was a way to first and foremost just recognize the important roles of early educators, and it went to childcare teachers, Head Start teachers, pre-K teachers, as well as family childcare home teachers, so really across the board system-wide to recognize it. I think for our team, we also felt really committed to saying, can we also study it and test it and see if it really has the impacts we think? Because our hope was that by capturing evidence about the impact of it, which we didn't know what the impact would be, we were hopeful that it would have benefits, but we wanted to test it, would be powerful for changing policy and changing the conversation about the importance of resources for this sector. And so when we did it, what we learned is that the program had very large effects, but those effects were concentrated in the childcare sector. And that's kind of not a surprising result. In the schools, there wasn't that much pre-K teacher turnover to begin with, and we didn't see that this money had an impact, at least on turnover. But in childcare, it cut teacher turnover in half over the 8 months we considered. And so I think that's important, you know, for two big reasons. One is now we know that it had this big impact. We can use that to advocate. We can use that to change the conversation. And then also earlier in this webinar, somebody had asked around, like, well, how do we make sure we're targeting resources to the people who need the most? And I think that finding really shifted how the state prioritized the money, focusing specifically on childcare rather than school-based teachers and on family childcare home workers. And so I think it does help to do this kind of work to be able to see who really needs the resources and how can they, in what ways can they improve experiences for kids.
Great. I think, you know, the folks in attendance certainly understand both of those, you know, both of those sort of sides of the coin, how important it is to have for children to have that continuity of care, and also for this workforce to be better supported in terms of compensation. We have a lot of folks questioning how their programs can participate in this recognition program. And of course, right now that's limited to, you know, based on the funds that are available for those publicly funded programs. And that includes private centers that receive federal child care subsidy dollars. These are the programs that are currently eligible to participate in this recognition program. And again, you know, what we're trying to do, and with Daphna's amazing help, really document the impact of that so that we can better advocate for and really try to make sure that these resources are, you know, expanded and provided to more of these teachers. Anything you want to say about that, Daphna?
I mean, I would just say that obviously at this point, the resources are limited, and we don't have enough to provide them to every early educator. But the premise is that by doing the work now in a way where we are careful and we are documenting and we are researching, I mean, I think for us, the long game is not around showing that this worked this year for these teachers, but around making the argument that we need to expand the way that teachers are compensated across the state and really across the country as part of efforts to improve early childhood. So it's very much, you know, this is not the recognition program is a stepping stone, I think, in our thinking around how do we change compensation more broadly.
Thank you. Just have folks noting that instructional assistants, it would be great to include them as well as programs that don't, you know, that aren't on the subsidy program.
Yeah, and I will say I have been using the term teacher, but the way that it is definitely the case that not all programs are eligible, but ineligible programs, any adult working directly with children for 30 hours a week is eligible for the program. So it is not limited to lead teachers or even assistant teachers. It's really for anyone working directly with young children.
Thank you. And we did drop a link in the chat to a web page that has more information about how communities can participate in the preschool development grant. We have folks who are so appreciative of your research, Daphne, and the findings that you're bringing. There's one question that reminded me of some conversations we've had over the last week where, when you use the term home-based, when you use family day home, the semantics around that are a little confusing. And, one of our participants is saying that in the Head Start field, they use that as a program option where services are provided for families who remain at home with their children. So a little bit of confusion by what we mean about home-based.
Yeah, I think that's something we are working on getting the terminology right for. I think we have been using the family day home language in part because that is just the way they are classified for licensing purposes in Virginia, but I think it is confusing, and also it's not preferred by some of the people doing the work themselves. And so I think, just thinking about the right way to think about this type of care and education option and how to describe it relative to other options like the Head Start home-based options and things like that is on our list of things to try to clarify.
That's right. Thank you. Let's see. I think that it looks like you've covered most of the questions. Let me just look one more minute. I guess I would like to land on one more question for you, Daphne. You've done this research in other states as well. Is there anything in particular about your findings in Virginia that are just most striking to you, or that have really kind of resonated for you the most?
Yeah, I mean, so I think the main thing I would say about that is that we are very fortunate in Virginia to do research with policymakers and organizations like VECF who take research extremely, extremely seriously. So I would say the main thing that I've been very excited about is the opportunity to push for studies that allow us to document these issues, and the opportunity to help think through how that should actually influence the design of policies. And so, like I said, I think our study about the recognition program is the first study like that that's ever been conducted in the country. And people talk all the time about, oh, we need to get early educators more resources. But I think kind of the ability in Virginia to actually take the time to study it, document it, I think will make a huge difference. So that's been great. And I think, we have gotten a lot of buy-in on the ground. I think there's a lot of efforts right now to really push on quality. So mostly I'm sort of excited about the momentum in Virginia to make some really big changes here with kind of buy-in at all levels from the providers themselves and the women we talk to doing the work and the community leadership and state leaders. So it's been sort of exciting to have to get involved in research at a moment where there is sort of a lot of collective energy to push this forward.
Well said, and it is an honor to work with you, Daphne, and just really appreciate all that you bring. Hopefully the attendees, many of whom are providers, can sort of get a sense of how important it is to us to document some of these findings so that we can really utilize that information, toward a change agenda. And you're so right that we're really fortunate that the General Assembly and the current administration are very, receptive and open to all of that. And so hopefully some good change will be ahead.
So Kathy, just to add on to that, I mean, the really amazing thing for us as researchers has been the engagement from providers, from teachers, and the very high level of survey participation, which helps us really learn. So in some of my prior work, you know, we send surveys out, we don't always hear back from folks. And so a huge thank you to you all for the work you do getting people to respond and engage and get that data. And please know that it is actually taken super seriously by the state and by efforts to improve. So thank you for kind of taking the time yourself to respond to those surveys and encouraging your teachers to do that. And also on this slide, we have our website on there for C Partnerships, which is the study of early education through partnerships with you all and with Kathy and the Department of Ed. So you can find a bunch of our reports there about Virginia and other states if that's helpful. And you can also always reach out to me if you have further ideas or suggestions about the work.
Thank you, Daphna. Really appreciate it. I'm so grateful to all of our speakers today. And just a couple of notes, we will be sending out the slides, the recording from today, and many of the links and other resources that were discussed or referenced today. Also, just want to let folks know that next week we will be having a couple of briefings that will be specific to how child care programs can access the new federal relief programs such as the payroll, the Paycheck Protection Plan, the EIDL, some of those resources that can be available to child care programs. We will have one session in English and another session in Spanish, and support with some additional resources and guidebooks about how to best access those resources. So be on the lookout for information about those webinars that'll be coming out soon. And just want to thank again all of the hundreds of participants that spent part of their day with us, and appreciate the great questions and the interest that you have. And we'll look forward to engaging again soon. Thanks to everybody and have a great day.